For the sake of of myself not embarrassing myself to myself and to you, I'm just gonna call you Thabeng
That's
from
right.
Nova Nordisk.
That's
Just
right.
it's up to you to extend and expand on what your career is and what you do and who you are and why you are here and all of that. Let's go, sir.
All right, perfect. So, like you say, my name is. First of all, thank you for having me here. My name is Thabeng Leping, and I am employed at Novo Nordisk in South Africa as the Director of Corporate Affairs and Market Access as well. So, literally, what I do is make sure that I create access to innovative medicines within the space of diabetes, so that whoever is reliant on the public sector is able to get access to treatment, but then also the people that are reliant on their private health insurance are able to get whatever has been prescribed for them to treat their diabetes. That's essentially what I do every day, negotiate for treatments to be available to the public.
Thabeng, let me just take you just a fraction back. You just said you are Thabeng. Give us your title. I know you're a director, but a director of 1, 2, 3, 4, 5, 6, 7, 8,
Yeah.
9, 10. Just take us through that and what your presence means here today. Because behind you, there's an Orlando Pirates sign. And how does Orlando Pirates and Nova Nordisk get together?
Right. So my role is quite expansive, actually. So market access literally means exactly that. So my full title is Director of Market Access, Public Affairs, and Communications. And so basically what that means is that on a market access point of view, I basically just negotiate with the medical aids for the correct price so that the price is resonant with the South African masses so that people are able to access all the medicines that we bring into South Africa, mostly insulin and also analogs, but then also GLP-1 treatments within the treatment of both diabetes and obesity as well. We do a lot of business also with government, and this is where the corporate affairs side comes in, where we work with schools, along with partners that we've got a memorandum of understanding with. So one of the partners is City of Johannesburg, but then we also work very closely with Gauteng Department of Health. Just last night, we were on the East End illuminating one of the hospitals blue in color, because blue is the color of diabetes. So we were just trying to create awareness within the community to make sure that the people are aware of the signs and symptoms of diabetes. So part of my function is basically just make sure that everybody is aware of the pandemic that diabetes is becoming lately. We've seen recently that diabetes has now surpassed HIV and TB as the number one killer of women in South Africa. And in men, diabetes is the second biggest killer, with the first position being cardiovascular diseases. But we also know that diabetes is a precursor to cardiovascular diseases. So it's become a serious issue for us to begin to tackle. This is why partnerships such as a football club, such as Orlando Pirates, become key for us. So we need people that are influential within the community space that would be able to help us carry the message to the communities, to the masses. As I say, if diabetes is already so prevalent in men, what is the quickest way, to get to those people in a social way? We find that football is probably a great leverage point to be able to target people to understand the impacts of diabetes.
One of the biggest clubs in Africa, the continent, is Orlando Pirates. You just went for Orlando Pirates. They fill up stadiums everywhere they go. Is it the quickest way to get the masses on board, looking at how good they are doing and all of that? I'm looking at the players here, the even development players, they're here. I mean, Happy Chele, the former captain, just tested. Was here as well. He just tested. Another former captain. Should be pleasing for you to work with the people that other people want to work with.
It is. It's quite exciting. I'm an Orlando Pirates fan myself. It's not the reason I'm here. It's really just purely because it was coincidental. But when we heard of the opportunity, I just knew immediately that we needed to be part of this. I'm so happy to see the activity around here as well, with the practice of Kutlase and Matebula, getting the community to partake in getting testing as well. If you look at the stats, 1 in 9 South Africans has diabetes, right? And we know that 50% of those people actually don't even know that they have the disease. And what better way to create an activation like this today so that people can actually test and screen for diabetes and know exactly where they are so that they know what steps to take in terms of looking after their health. And so as you mentioned, Orlando Pirates is a big football club, not only in South Africa but also in Africa as well. Football is enjoyed not only by adults but children as well. And the reason I bring out children in particular is because, as I said earlier, that one of our partners is City of Johannesburg. And so with some of the work that we do with them in primary schools, where we target children between the ages of 6 and 13, and there all we're doing is teach people how to eat correctly, promote eating from the ground up so that we deal with the issue of obesity as well. And when you speak to school principals, they tell us that they're beginning to see an early onset of diabetes in school-going children as well. So this is a problem, of course, and this is the reason why a football club such as this is able to target both the young and the old alike and make sure that we get the message out there in terms of the dangers of diabetes.
I've been one of those people who has actually been accustomed to this place, the doctors and all of that. And for a normal fan out there, and who buys a ticket for 60 rand, 80 rand, depending on the match, they would say diabetes treatment is expensive. Just take us through the easiest ways for the fan that's going to a match at 3 o'clock who has diabetes to get themselves sustained through the day. I know you're not a doctor, but is it possible for one to live with diabetes and be healthy while they know that they cannot afford all the expensive medicine?
One of the luckiest things about South Africa that we have as a healthcare system is that even if there's only 9 million people that have a medical aid in South Africa, and yet we've got the rest of the masses reliant on the public sector, the public sector actually is free because the government of South Africa buys medicines from manufacturers such as ourselves, and they make sure that whoever is diagnosed with any of these non-communicable diseases has got access to treatment. We work with government quite closely. It's part of my function as a corporate affairs director to make sure that we help each other in a partnership with government as well. And so I can confirm that as of today, we supply more than 95% of all the insulin in the public sector. So there's no reason why anyone would be diagnosed and end up not getting the treatment that they need within the public sector. Yes, there are slight differences because options in the public sector are limited, right? But we also pride ourselves with the fact that recently we had a picket from one of the patient advocacy groups called MSF. And they were fighting against Novo Nordisk not making available insulin pens within the public sector and only vials. But we've since managed to actually correct that situation, and we're so happy today that patients actually have option between using a vial or an insulin pen for an analog insulin, which is actually better treatment or better insulin for the diabetes. So there's no reason. We've made sure as a company that we go into a partnership with government. We've got a 3-year tender, which finishes in 2027. So we know that treatments are available in the public sector. So we can guarantee you now that if anyone screens here at this event today and they are found to have been living with diabetes unknowingly, and the doctor decides to put them on any treatment of diabetes, I can guarantee you now 100% that that patient will be able to get the care they need from any of our hospitals.
That is quite massive, listening to you saying all of that. But as we close it, what is your message to all the Orlando Pirates, Kaizer Chiefs, Mamelodi Sundowns, Amazulu fans, whoever that can be watching or listening to this conversation between me and you when it comes to the diabetes that is a silent killer, if I may say so myself. Ungathini nje kubona just to make sure hore ba tseba hore pheko e teng ka ntle kwa hore they can actually live longer, a healthier life.
Yeah, so our call to action is that people should screen. People should always look out for the signs and symptoms. That's the fundamental, and this is the reason I was saying to you that the stats are such that diabetes is actually the second biggest killer in men. So, please look out for your central obesity. Look out for the signs and symptoms that we've put around here, actually around the complex where we are now. Your thirst, your eyesight, so look out all of that and make sure that you go to your nearest doctor and screen. If you are able to still come out here where we are today, please come out and screen. For additional information, if people want to read up about diabetes, they can go to www.diabeteswhatsnext.com. And on that website, there's basically all types of information that people can read up about signs and symptoms of diabetes. If you do have it, how do you manage diabetes? And also diet and lifestyle is something that we also advocate, so that you're not just reliant on the medicine on its own, but also just on keeping an active lifestyle.
Somewhere in Mapetla or in Muletsane will not know how to go to www. They believe in walk-ins. Do you have walk-in centers, or would you recommend a local clinic?
So I would recommend any of the PHCs, so the primary healthcare clinics, right? We know that, for an example, if you live here in Diepkloof, you can't just go to Barra because it's a big hospital, so you need to be referred by your primary healthcare provider. So go to any nearest clinic or regional hospital, or any healthcare facility that is owned by the government. And tell them you've come to screen for your diabetes, because listening to all the messages that you've been exposed to, you believe that for your age, but then also how you feel, you want to test if you have it, and if you do have it, you'd like to be put on treatment. It doesn't matter any clinic in the communities, any township. We've got many of them, and I can guarantee there's a nurse to help you, and there's a doctor who can't wait to see you as well.
You were born for this. You just made it all simple for me, the listener on radio, and it's just one of those where we just say thank you so much, Thabeng. Nova Nordisk, I mean, you guys have been there. It's one of the longest serving, and I'm told you the biggest importer of insulin.
We are. So we supply almost 100% of all the insulin requirements for the South African public. So if you're a patient living with diabetes out there and you are on insulin and you're reliant on the public sector, chances are that insulin comes from Novo Nordisk. And we've been around. We were celebrating 2 years ago being in South Africa, or being in the world rather, as a pharmaceutical company for 100 years. So we are in this world for 102 years, and in South Africa we've been here for about 70 years.
Lady Dinosaur, thank you so much for coming through, and we really appreciate what you're doing, Thabeng. You guys have got it all going on, and really just for saving lives and prolonging lives. I'm looking at people, look at their testing just through the window there. For now, they're testing, and it's such a beautiful thing to see.
Very good to see.
You guys have come on board with Orlando Pirates and making sure that also get checked and tested.
Thank you for having me. Appreciate it.